Thanks for being an Aetna Medicare Prescription Drug Plan PDP member. Did you know that all Medicare prescription drug plans have 4 phases of coverage? Understanding these phases can help you prepare for possible changes in your out-of-pocket drug costs. To see how the phases work, let's follow Michael, a fellow SilverScript SmartSaver PDP member, as he moves through them. Phase 1. The deductible phase. Like many American adults, Michael takes prescription drugs to manage his health conditions. As a SilverScript SmartSaver member, Michael knows his plan works hard to make his medications more affordable. The plan negotiates pricing with drug companies to bring down drug costs for members. Then the drugs are divided into 5 groups or tiers. The lowest tiered drugs are usually the cheapest. Your plan may have a deductible like Michael's. If it does, you'll pay the plan's negotiated drug cost up to the deductible limit of $505. If your plan has no deductible, like some Aetna plans, you'll skip the deductible phase and go right to Phase 2. Phase 2. The initial coverage phase. After a few months of paying the full negotiated price for his drugs, Michael hits the $505 deductible limit. Now he moves into the initial coverage phase. During this phase, you and the plan will pay a portion of the cost for each prescription you fill. You will either pay a set dollar amount, called a copayment, or a percentage of the negotiated drug cost, called coinsurance. Copay and coinsurance amounts are listed in your Summary of Benefits, or SB. You stay in the initial coverage phase until you and your plan spend $4,660 on covered drugs. Many people stay in this phase for the rest of the plan year. Phase 3. The coverage gap phase. Partway through the year, Michael learns that he has rheumatoid arthritis. His doctor recommends a prescription drug to help with his pain. It's a Tier 4 brand drug, and it's expensive. But it really helps Michael, so he decides to keep taking it. As a result, the total drug costs pass the $4,660 mark. Michael now enters the coverage gap. Most Medicare drug plans have this coverage gap, also known as the Part D donut hole. During this phase, you'll pay 25% of the negotiated cost for generics and brands. The Aetna SilverScript Plus plan offers additional coverage in the gap for Tier 1 and 2 drugs. If your out-of-pocket drug costs reach $7,400 for the year, you move to Phase 4. Phase 4. The catastrophic coverage phase. Very few people reach the catastrophic coverage phase. In this phase, you'll pay either a 5% coinsurance or a small copay, whichever cost is higher. You stay in this phase through the end of the plan year. Every member's experience with coverage phases is different and depends on personal drug costs. Looking for ways to keep your drug costs low? Start by asking your doctor about lower cost options such as a generic drug or lower tier drug. And when you fill your prescriptions, try to use a preferred pharmacy. They work with your plan to offer larger discounts than other pharmacies. This helps members save money. To locate a preferred pharmacy near you, go to aetnamedicare.com/findpharmacy and enter your zip code. We have up to 66,000 network pharmacies, and more than 23,000 of them are preferred pharmacies. To learn more about your Aetna Medicare PDP plan, visit aetnamedicare.com.